Good evening, viewers. This is Vasudhi. Today we'll be starting the second part of the disease causing control chapter. So in this section, we will discuss some of the diseases which are caused by bacteria and protozoa. Okay. So first we come to cholera. So before I start, I will request you to please do subscribe my channel if you have not subscribed yet. And if you are a new viewer to my channel, because that will notify you as soon as a new video is uploaded. And if you are a new viewer to my channel, if you are liking the videos, press the like button, share with your friends so that they can also be benefited from these videos, and do meditate before you start it. So before we start, let us also concentrate on a point of light for the meditation. Okay, so that light is for the view, concentrating on a point of light. I think that light is for the view, and the feeling very relaxed, free from any tensions and worries. The feeling energy, utilize that energy for healing the work that we do, the giving of appreciation, the way the question. The first is cholera. The organs affected in cholera is the intestinal tract. Okay, and the bacteria, the pathogen which is due to which this cholera occurs, that is Vibrio cholerae, it's a bacteria. Okay, the incubation period is few hours to 6 days. That is, it takes time to get the first symptom, incubation period and stuff. Okay, so symptoms are vomiting and loose motion. Very little or no urination due to shortage of water in the body. In this cholera, there is loose motion, too much of loose motion in vomiting. So there is dehydration possible. And for that, no urination occurs or very little urination is occurs due to the shortage of water in the body. And due to that, what happens? Urea accumulates in the body. And that can be fatal because urea is a poisonous substance which accumulates in the body, which, if not treated properly, it can lead to death. Okay? So that occurs, those are the symptoms. Then treatment is what? As there is dehydration, we need saline water injections to supply water to the blood. Okay? How does the transmission take place? So transmissions, that is spreading, occurs through food and water. It is called fecal-oral route through which the transmission takes place. And the contamination takes place with the dust and by direct transport through flies. How? While the flies sit on the patient's excreta and they mechanically carry the germs inside on their body. So that germs, they stick on the hairs, the spiny legs and the bodies of the flies. And when they sit on the exposed food that are eaten up, okay, then when they sit on the exposed food, they will shed these germs on that food and the food gets contaminated. Okay. Then how to prevent this disease? For that, good sanitation is required. Flies should be killed. The food and the cut fruits that should be kept covered properly. Okay? Then, so that the flies do not sit on them, and we are preventing the flies. Okay? Then boiling water for drinking. Drinking water should be boiled, and we should eat cooked, well cooked food. Okay? And there is immunization also, that is anti-cholera injection is given. So that's in the improper sanitized areas, the persons generally they are prone for this cholera. So those people are given anti-cholera injection. Okay? Next we come to typhoid. Here also the intestine is affected. The intestine is affected. The pathogen here is also bacterium. It's a flagellated bacterium which is known as Salmonella typhi. And the incubation here is about 7 to 14 days and maybe as long as 30 days. What happens? This incubation is, I told you that it may be 7 to 14 days and maybe as long as 30 days. But after recovery, the patient, when the patient recovers, in about 2 to 3 weeks, the patient is left very weak. The patient becomes very weak. The patient can relapse also. Okay, and the patient can sometimes, they are carriers after the recovery. Okay, the incubation period is 7 to 14 days, and it can be as long as 30 days also. But the patient becomes sometimes the carrier after recovery because they can relapse also. And within 2 to 3 weeks, they become very weak. Okay. Now, how this disease is transmitted? The patient passes out the germs in his excreta, and that is spread by the flies. The same process, the flies feeding on the excreta and then sitting on the exposed food. Then direct contamination of food, particularly the milk. Okay. So that can lead to typhoid. Then how it is treated? By an antibiotic known as chloromycetin. Okay. And how it is prevented? Prevented is by anti-typhoid inoculation every year. Okay. Injection immunizes, a vaccine is given, that is anti-typhoid vaccine, and proper sanitation, then control of flies. Then symptoms are, major symptoms are continuous fever, usually that is rising in the afternoon. So major symptoms are that it has continuous fever which rises in the afternoon, and there is sometimes reddish eruptions which appears in the chest and the abdomen. Okay. These sometimes happen, but generally there is what continuous fever, which rises generally in the afternoon. Then comes another disease, bacterial disease, that is tuberculosis. The organs affected generally is the lungs, but sometimes brain, kidney, and even bones are affected also. Then pathogen is Mycobacterium tuberculosis, which is a small rod-shaped bacteria. Again, its incubation period is 2 to 10 weeks. Now here the symptoms are the surrounding tissues form a kind of wall or tubercle around the germs. Okay, the germs, they get a wall around them, a tubercle or a wall. Okay, the most people, they generally overcome these infections, but low immunity, if there is low immunity, the disease becomes severe. The main symptoms here are persistent cough. The person coughs too much. When that is persistent also, the cough stays for a long time. Okay. Then afternoon fever is there. The mucus that comes out during cough, that is bloody. Okay. Loss of weight and fatigue. There is chest pain, breathlessness also. Okay. Now, how it is treated? In the early stages, streptomycin is given. That is an antibiotic which inhibits the growth of the bacteria. Okay. And prevention BCG vaccine is given in March, the March 24th day. Okay, it is celebrated as Anti-Tuberculosis Day. Okay. And mode of transmission is through air, dust, sputum of the infected person. Okay. Now we come to some protozoan disease, that is malaria first. Here the pathogen is a plasmodium. Plasmodium, which is the pathogen which causes this disease. Okay. This is the protozoan, and mode of transmission is through Anopheles mosquito, the bite of the female Anopheles mosquito. That is the vector, which is known as malarial vector, which carries this plasmodium and causes the disease. Now, the uninfected female mosquito, when bites an infected person, it sucks the blood from that infected person, and along with the blood, it sucks the parasite also. That is, along with that blood, plasmodium, which has caused the infection in that person, that also it sucks. Okay. Now, the parasite inside the mosquito's body, it grows. Okay. It multiplies in the gut of the mosquito. The mosquito then again bites an healthy person. Then what happens? It transfers the parasite's infective stage along with the mosquito's saliva into the person's health, the healthy person's blood. Okay, bloodstream. So what does it do? It bites the healthy person. It takes the gives the when it takes the blood, no, before piercing after piercing this proboscis into the healthy person's skin, it puts the saliva into the person's blood, so that the blood, while sucking, does not coagulate. Okay, that time it will give its saliva, it will pour its saliva into the bloodstream of the person, of the healthy person, and along with its saliva, the parasite also goes inside the healthy person's blood. And now the parasite goes inside the healthy person's blood. Here it multiplies in the liver cells, destroys its RBP, and it starts infecting it, and now it will infect that person. The affected organ is the liver. Incubation period is about 3 weeks, and symptom is chill and high fever every 3rd or 4th day. Okay. Treatment is drugs, that is quinine, Paladrin, camoquine, etc. Disease area is common in hot and humid countries. Okay. And control, how can you control? By destructing all the stages of the mosquito, avoiding mosquito bite by using mosquito net, repellent. So these are the about the malaria disease. Okay. Then we come to amoebic dysentery. It is an amoebiasis, also called amoebiasis, and the pathogen here is Entamoeba histolytica. Okay. And its mode of transmission is by contamination of food, especially by flies. Organs affected here is large intestine, and incubation period is about 1 week. Here the symptom is the lining of the large intestine is destroyed. The diarrhea, there is severe diarrhea. Okay. Gripping pain is there, and discharge of mucus. Okay, and sometimes blood also comes in the stool. Then how do we prevent this? Through proper sanitation and protecting food from dust and flies. And how it is treated? Through hydration and antibiotics are given. Then we come to another protozoan disease, that is slipping sickness. It is caused by two types of pathogen, Trypanosoma brucei gambini and Trypanosoma brucei rodentii. These both are flagellated protozoa. Mode of transmission is by bite of CC flies. CC flies are the vectors which carry this Trypanosoma protozoan and causes the spread of this disease. Okay, the organs affected here is the brain, which swells due to this disease. Incubation period is 1 to 2 weeks. Symptoms are phase 1 and phase 2 are there. So phase 1 is the preliminary early stage, and later phase is known as also neurological phase, or it is a fatal phase, which can lead to death. So first phase 1, there is fever, headache, itchiness, and joint pain. But in the later phase, that is neurological phase, there is confusion, poor coordination, numbness, and trouble in sleeping. Okay? And how is this treated? Through drugs like millarsoprostol. Okay? And it's prevented by using insecticides to kill the CC fly and protect oneself from the bite of the same. Using repellents or fly traps to stay away from the flies, and maintaining clearings around the villages and also residential areas. Okay, so residential areas and villages, they should be clean. Okay, using repellents so that the CC flies are, the flies do not sit on the body of the person, of the humans. There are fly traps also to stay away from the flies, and even insecticides are used to kill the CC fly and to avoid oneself, to protect oneself from the bite of the CC fly. Next, we come to the disease which are caused by parasitic worms. Okay, so here first is Ascariasis. Okay, it is the worm infection which is caused by a pathogen called roundworm. Okay, it is caused by Ascariasis lumbricoides. Ascaris lumbricoides. Okay, Ascaris lumbricoides cause this infection. The organs affected here is intestine and sometimes lungs in severe cases. Okay, and mode of transmission is round. These are called roundworms. Okay, common they are called roundworms, and these roundworms are elongated cylindrical worms which are about the size of an earthworm, and females are slightly longer. And the males, they have their hind portion slightly curved. And in the intestine, they absorb the digested food from the host. The females, they lay eggs several thousands per day, which passes out along with the patient's feces. When the patient excretes, that time, the eggs which are laying inside the intestine of the patient, that comes out. Okay. And then eggs get scattered in the soil, and when they reach the vegetables in the fields, and the children on the ground, they may get these microscopic ends on their hands, and the infection can occur when they eat those vegetables or any, or rather when they are in the hand also, if they do not wash their hands and directly put some raw vegetables inside their mouth, and then what happens, these eggs go inside mainly the children. The symptoms are, generally there are no symptoms, okay? But heavy infestations, when they occur, they cause lung or intestinal problems like coughing, wheezing, pneumonia, blood in the mucus, chest discomfort, fever. These are in the lung lung symptoms. And in the case of intestines, they have nausea, vomiting, diarrhea, severe intestinal pain, loss of appetite, weight loss, malabsorption, and visible worms in the stool. Okay, in the stool, when they pass out, this will the patient which gets infected, when they pass out the stool, we can see worms inside it. Now, how it is treated? By antiparasitic drug, and during large infestations, surgery of the intestine may also be recommended. And how it is prevented? By practicing good hygiene, dining only at reputable places. Okay? And like when people go inside the street hotels, no, so we should avoid those street hotels. We should dine at reputable places where it is clean and the proper hygiene is maintained, like that. And drinking only boiled water, and avoid raw fruits and vegetables where there is no modern sanitation. Okay? Then we come to Taeniasis. Okay, it is a worm infection which is caused by Taenia solia. Okay, and organs affected also here is intestine, and two common worms are there. One is mode of transmission is two types of infections occur. First, by eating infected pork, and then second is by eating infected beef. Okay, both of them, they remain in the intestine and growing to meters in length. They grows to about a meter in length. The taenia, which goes inside the intestine, there it grows to a meter, almost a meter in the length, and absorbs most of the horse digested food while the patient becomes terribly weak. The mature worms break off a small segment from its tail end, which passes out along with the feces, which contains the eggs. Okay, each segment contains eggs, and the small portion from the tail region it will cut off and come out with the feces of the patient. Now, these eggs accidentally, when they are ingested by the pig or a cow, these will hatch, forming the larval stages, which will settle in the muscles of the new host, that is in the pig or the cow, in the muscles of the pig or the cow. And when the humans eat these meat, that is pork or the beef, okay, raw or not cooked properly, then these larval stages will get inside the human body where they mature in their intestine. Okay. And the symptoms here also, there will be no general symptoms. Okay, but in severe or chronic cases, they include stomach pain, loss of appetite, nausea, weight loss, stomach absence, stomach upset, and vitamins or mineral deficiency. Tapeworm segments may be visible when this passes out the stool, okay, in the anus, through the anus. Then common is mainly weight loss. How it is treated? Antiparasitic or anti-helminthic drug. Adequate sanitation, cooking meat to safe temperatures. Then we come to filariasis. It is also called elephantiasis. The pathogen here which causes this disease, that is Eucheria bancrofti. Okay, the organs affected is the lymphatic system and the connective tissues of the human body, that is the limbs, mainly the limbs. Okay, lymphatic system and mainly the limbs are affected. And mode of transmission is through the bite of Culex mosquito. Here the symptoms is the enlargement of the ankles, they enlarge. Okay, fever with chills in acute cases. The legs become swollen, resembling that of the elephant, and therefore it is known as elephantiasis. Here, there is a blockage of the lymph circulation by the worms. Okay, that's why the limbs swell, which results in the inflammation of the lymph glands and the lymph vessels. How it is treated? By eradication of the vector. The vector is killed. That is, Culex mosquitoes are killed. Okay, and using of antibiotics and anti-inflammatory analgesics. Okay, and this treatment and prevention is using insect repellent on exposed skin, especially at night. That is during night when we are going to sleep, or then when we are in the night when we are going around, we should apply some repellent cream or lotion so that these mosquitoes do not sit on our body. Okay, and then sleep under a mosquito net. So this much is for today. Go through these videos. If you have any doubt, please do write in the comment box. And if you're liking the video, press the like button, share with your friends so that they can also be benefited from these videos. And do meditate. And don't forget to subscribe to the channel if you are liking it. And if you are a new viewer to my channel, because that will notify you as soon as a new video is uploaded. So stay tuned and do watch. Thank you.